Our guest today is three personalities rolled into one. Please join me in welcoming and an entrepreneur, the founder director of Ujjala Cygnus Hospitals, Dr. Shuchin Bajaj. Welcome to the show, Dr. Shuchin.
Thank you very much, Vivekji, for having me. It's a pleasure to be here.
You chose to build hospitals away from the metros in markets where the larger hospital chains had written those market offs. Where did you derive that conviction?
There are already 20,000 doctors in Delhi. I am becoming one more. What difference will I make? And I wanted to really treat that community which I came from and who were suffering very clearly due to either non-availability of healthcare or too expensive.
Your cost structure should be very, very different from these larger corporate hospitals. What's different in your case?
In a hospital, if you can provide good quality outcomes, you should not be forced to sell your house to save your life. One is we don't own any land or building, so the real estate doesn't cost us. Even in equipment, we take our capex very seriously. So we follow the Pareto principle ruthlessly, that 80% of things can be done at 20% cost. Even though a doctor would definitely say that no, I would love to have those machines. As a doctor, I also love to play around with expensive toys, fancy toys. Yeah. But if that does not serve treating my patient affordably, I have to take the tough decisions.
I was reading somewhere that in India, for a lot of families, 70% of their lifetime's earning goes away in the last 10 years of their life because of diseases. What needs to be done to change that situation?
So, of course, Ayushman has helped a lot. But again, doesn't really address the entire cost of the disease. You can't really go back to the factory you were working in, right? The field job that you were doing. So your future earnings that are lost run into much more amount than 30 years of earning you've lost now. So this cost nobody understands. This is something that as a country we have to do. Insurance is very good as a band-aid, very well needed, right? But who is incentivizing the whole system to make sure that we do not have injury? Preventive and primary care has to come in a huge focus somehow.